Hello, everyone, and welcome. My name is Liana Ramos, and I am the Marketing Associate here at JMIR Publications. I'm excited to welcome you to today's webinar, which is part of our JMIR Mental Health series in collaboration with the Society of Digital Psychiatry. Today's session topic is Enhancing Therapy Engagement Through Digital Tools for Clinicians and Clients. We will begin with that in just a moment, but before we do, I want to call out a couple of housekeeping items. So firstly, all microphones will be muted during this webinar. However, we encourage you to engage with the panel by submitting your questions. You can do this easily by typing your questions into the Q&A box located at the bottom of your screen, and there will be a designated time for the panelists to address them. Additionally, we want to let you know that this webinar will be recorded and the recording will be available on our YouTube channel. So that's all from my end right now. I'd like to introduce Dr. John Torous. So Dr. Torous is the director of the Digital Psychiatry Division at Beth Israel Deaconess Medical Center, which is a teaching hospital of Harvard Medical School. He also serves as the editor-in-chief of JMIR Mental Health. So with that, I'll pass things over to Dr. Torous to introduce today's speaker and to get us started.
Excellent. Welcome and thank you to the JMIR team and Society of Digital Psychiatry for hosting. We have a really awesome guest today. We have Brian E. Bunnell, PhD. He's a clinical psychologist and assistant professor in the Department of Psychiatry and Behavioral Neurosciences at University of South Florida, Missouri School of Medicine, where I hear it's warmer than Boston, but not too much. But he directs the Innovation and Mental Health Lab. He earned his PhD in clinical psychology, and he's dedicated his career to advancing digital mental health with the goal of improving healthcare quality and access. And he's going to tell us a little about his work, how we got here, and a cool tool that he has that is actually free to use, which is surprising and refreshing in all of it. So, Brian, thank you so much for joining us. Today's topic again is engagement, and it's such a critical thing in digital mental health. I think sometimes we forget about it, but it's something you can approach from so many different angles. And just maybe, how have you begun to even think about this broad word of engagement in digital mental health?
Right. Well, I think there are definitely different levels of engagement. And I
I
I
should say
think
we can start telehealth. Like we can start small
oh
and go up.
that's
Yeah,
fine. No, no, I think just like just to reiterate kind of what you had just said is that engagement is very important, and it's one thing, especially as a healthcare provider, for us to be recommending that our patients engage in a certain behavior practice, whatever we're trying to teach them, certain skills. But getting them to actually do it is tough, right? And we know that when they do practice those skills and they do engage with those the things we're asking them to do, then they improve, right? And I think with digital mental health, it's digital health in general, it's the same, right? Like it's great if we can create apps, we can create solutions that hopefully are effective and help people. But if we can't get them to engage with them and to sustain that engagement
yeah,
over time, then it's kind of like, what's the point, right? So
yeah. I
my
always
thought.
have the simple analogy. It's like a bicycle. If you don't pedal it, it doesn't matter what technology you have. You kind of need the wheels to turn somehow. It's
Absolutely.
a little bit simple of an analogy, but that's where my mind always goes to. It's like, is the
Well,
bicycle?
unless it's an e-bike, right? And then you can just throttle it. But so we might have
That's
to
true.
upgrade that. Sorry.
But I mean, let's talk just like start with telehealth. You've done so much cool work, and we're going to try to talk through again the different levels of what you've done. But even again, with COVID, as we know, we moved towards a lot of video visits and telehealth. We've moved back a little bit, but let's just talk about what you guys have learned about engagement for telehealth, and we'll broaden it to the world of everyone's favorite apps.
Absolutely. Yeah, definitely. So we were doing a lot of the studies looking at telehealth prior to COVID and really kind of pushing it and pushing its use. And really, a lot of our studies, we were just finding that few providers were using it, and the ones that were using it for probably like less than 25% of their sessions in general. So then during the pandemic, that all changed. It was one of the silver linings of the pandemic is that we got an advancement in a lot of advancement in telehealth. So saw that jump to about 97% providers using it for
Yeah.
amount of their time. Yeah. And, to illustrate that in another way, we collaborated with NIH on a study where we were looking at telehealth usage just the first couple months of the pandemic and the months before. And we looked at just one commercial telehealth platform's data, and on average, every month they were doing about probably 5 million session minutes.
Big number.
And within the first 2 months, that jumped up to 200 million. So from 5 to 200 million average session minutes every month on just the one platform. So it was pretty amazing seeing that growth. And also, to comment on the what we found though is a lot of folks earlier on, providers, I say folks a lot, sorry, I'm in the South, but early on they weren't so comfortable with using telehealth, but as a result of the pandemic, we kind of got forced to do that, and we did find though that the longer they used it, just like with most things, the more comfortable, the more confident, the more satisfied they became, and most continue to use it after the pandemic. So we see anywhere from like 70 to 80% of mental health clinics are still providing some telehealth services, which is pretty amazing.
And you wrote a lot about how training and competency for clinicians matters a lot for engagement too, right?
Yeah. So I was fortunate to I served as director of research and scientific integrity officer for DoxyMe Inc., which is a commercial telemedicine platform.
Yeah.
And we did a lot of research on this, and it was really great synergistic work because we're working with our those telehealth providers, but we're getting some really great rich data to publish on the research, but then also learning a lot about their needs and finding out more about what they needed to be successful in telehealth practice, and really like training played a big role in that. So we were able to implement like a lot of seminars, webinars, the training and improving telehealth practice, things like that. And so training was like a big kind of component of that. But I think kind of the one of the bigger drivers of engagement in telehealth from the provider perspective is that as they were forced to use it more, they really started to experience the many benefits of it and see the benefits to their patients, right? And we've looked at that kind of subjectively and objectively, using subjectively looking at like kind of like provider perspectives on this, but also objectively looking at real world data sets. And
Yeah.
A lot of these benefits are, better. The providers had better access to their patients. The patients had better access to providers, decreased costs and travel time, better work-life balance, which is overall
a good thing. No one's going to argue against that.
It seems like a myth to a lot of us, but it is achievable. And then also like fewer missed appointments, right? And providers, we depend on patients to show up to their appointments because that's how we make a living, right? So so it's that I think that made a big difference. People really started to realize those benefits as well.
Yeah. And again, well, telehealth, again, it's still carrying on. Again, there's been some pushback to in person, but again, our clinic say it does all telehealth that I do and say in a digital clinic here. It's been, again, apps kind of also got a boost during it because there's a lot of things you could do on an app, right? From mindfulness to self-tracking to CBT. We'll cover AI next, but not here. But I think what were you guys learning about just about people using apps more in a self-help-ish way?
Right. Yeah. So there's a lot of excitement about apps over the last decade, especially. There's like anywhere from 15 to 20,000 mental health apps out there. And many show promise, right? But the problem, particularly for self-help apps, has traditionally been sustained engagement. So we see like a lot of usage drops off pretty sharply after about 15 days and even more after 30 days. So we, in my work, have taken kind of a different approach. So instead of developing kind of more standalone self-help apps and contributing to the 15,000 out there already, we directed our efforts more towards developing digital health solutions for providers, clinicians. And our approach to that is we do a lot of meetings and work with mental health providers in the community. We learn a lot about their pain points and barriers they're experiencing, and then we work with them to come up with digital health solutions. And That's been really a really awesome process. And we've really, found that mental health providers they're really invested in maintaining a strong therapeutic relationship with their patients, but also engaging those patients in treatment in the therapy process, both during the sessions and then between the therapy sessions, which also supports the therapeutic alliance. And these are some things that are very, very important, to providers. And so we focus more
Yeah.
on developing apps that will help support them in overcoming barriers to those goals, really.
And I think it's really critical work, and I'm glad you're bringing it up because I think a lot of self-help apps don't get used, as you said, and they're designed really well. They've been built well, their evidence is good, but I think that care still involves a dyad of a clinician working with a client or patient together as a team. And if the technology only supports, if it kind of excludes the clinician, I do think that it's not going to have that engagement that you want. And there's again other reasons too around low engagement, but it has been pretty striking that it's hard to get the apps to go, and there hasn't been as much work around designing with or for clinicians. I think that we got the word out that patient co-design matters, and it does. And we've done a good job there, but I do agree with you that we've not really tackled the other half of it as well. And that's why I think the work that you and your lab do is really spectacular, that you guys are just charging right into it and kind of sharing what we can learn from it and how it goes. In your sense, again, well, the clinician part makes sense. Let's say I spend millions of dollars making my app gamified. I put leaderboards, I put beautiful design. Do you think you can like buy your way out of engagement if there's not clinicians involved? And again, buy is the wrong word, but like, can I design my way out of this?
If a clinician's not
Yeah.
involved. Well, like you said, there's a lot of reasons why people don't engage, right? And it isn't generally. I don't think it's generally people lose interest or they're and they've done a lot of research looking at this, but some people just get better. Some people and then they just drop off the app, and that's good, but we don't always know that they're getting better because they're not using the app anymore. But others they get kind of as we talked about, kind of notification fatigue, where it's just like you have a million apps on your phone and all of them are blasting you with notifications all day. It's hard to sift through those, and also it's tiring and frustrating, right, to do that.
Yeah.
So I think those are some of the things like we found over the years that people kind of struggle with. I don't know that really like taking the clinician out of it and designing your
Yeah.
way out of an app or out of the engagement problem is really possible, though.
I I would agree with you. Again, again, someone can prove us wrong. That's the beauty of science. But I don't think we've
Please
seen
do.
I don't think we've seen that, at least the evidence kind of publicly come out in a rigorous way for it. I think the beauty of digital health is we're always open to see new things, and the evidence will kind of prove what it is. But again, we're saying that engagement with telehealth, clinicians were willing to move to it because, as you said, they saw the benefits, and you helped show that. Apps, the self-help ones, kind of had trouble because the clinicians weren't part of it, and you've done some nice work on that side we'll return to. Clearly, everyone is thinking about AI today and probably tomorrow and the next day. And by some indications, AI can be too engaging for some people, right? We have reports of people having very long conversations that end in tragic outcomes. We have no clear definition on how many people use AI for mental health. I'm settling around like 33% of people have tried it, like one in three have tried it. There's different numbers because we haven't defined it, but what's your sense kind of on your expertise on clinician engagement, kind of app engagement? Like, is AI engaging? Is it too engaging? Is it not engaging? Do we just not know because it's all changing? It's a hard question,
And,
but
I think that again with this there's different levels, right? So if you're just talking about basic kind of chat, like we'll just use for example ChatGPT,
Fair enough.
Going in, it's very useful for like answering questions really quickly and getting information that way. For some folks, and that can be helpful for clinicians, probably maybe not so much. But we have a lot of really cool tools that I think are available, right? So uh, for like AI scribes, for instance, like a huge uptake of that. And it's very
Yeah.
useful and saves a lot of time, right, for folks. And efficiency is key when you're a provider. Like, I mean, as we know, like you gotta get through
Yes.
your work. And accuracy is really important too. And I think, we're not really there yet on the what I think is like probably one of the great opportunities with AI, which is accurately kind of like predicting, detecting and predicting diagnoses, risk, and then potentially using that for triage, I think is like really cool opportunity. And although we're starting to see some of those tools out there, I don't think they're really heavily used yet. But I think that those are, some options we're starting to clinicians are starting to use more and more. And then, the other kind of like really great tool that I think some people are using, but we're still doing a lot of research on this is kind of like more personalized messaging, symptom tracking, and hopefully we'll get more into like the kind of the personalized interventions and where the AI can kind of assist the therapist or the provider to the
Yeah.
therapist in kind of making those clinical decisions. So getting clinical decision
Does
support.
seem like it's coming, that it is going to kind of be
Absolutely.
supporting. And you could, again, one simple framework I always use is like, what is low risk? What is high risk? What is easy to automate and hard to automate? I would
Sure.
personally argue therapy seems very high risk and hard to automate. Tools to help clinicians deliver better, more effective care seems lower risk and perhaps a little bit easier to automate, kind of like the scribes, and they can be better.
Yeah.
Seems like a better starting point. If someone said, John, do you want to start on the highest, most dangerous one or the easiest, simple one? I would personally start
I, I'm
there.
going to stick with helping the providers do their jobs easier and more effectively. I don't know.
Yeah.
I don't even want to get into that.
No, well,
In my
yeah.
work, I don't want to move into
And
that.
maybe to that, again, you and your team have developed adhere.ly. I'll put the link in the chat, which is a pretty cool tool. So maybe you could tell us a little about what it is, why you developed it, and just some of the lessons you've built in building a tool. Here we're talking about engagement, and you can give us a real world run
Yeah,
through of what it's like. And I'll put down the chat right now for everyone.
absolutely. Thanks. Yeah. So we call it Adherely, but the URL is in the name, so just adhere.ly. And we, as I mentioned earlier, therapists are very invested in engaging their patients in treatment, both during and between therapy sessions. And a lot of my earlier work was focused on homework, as we sometimes call it, not necessarily to patients because nobody likes the word homework. I think that's
No.
ingrained in us as children. But
Yeah.
but we know when patients practice skills that are learned during therapy, in between those therapy sessions, their outcomes are improved, their treatment engagement improves, the therapeutic alliance improves. There's always like really great benefits of this. But unfortunately, engagement in that practice tends to be fairly low to moderate. And we use
Yes.
the term adherence, kind of homework adherence or, between session practice adherence. Looking back, I probably would have called adherently engaging or engaging,
Engagedly.
something like that. But we did what we did. Um, but we've really we were doing some of the work trying to like look at reasons why, basically barriers to it's kind of like low adherence to provider recommendations, to practice skills,
Yeah.
um, and pretty the most like salient kind of reason for this is like patients, clients, like they simply kind of forget what to do, how to do it, and when. So we worked uh, with like directly with mental health providers in the community to co-design a solution, a provider-facing solution that met kind of like the most important things to them that we found over a lot of our work. One, it was something that was secure, HIPAA compliant, right?
Makes
Free
sense.
or low cost, easy to
Love
use for
that.
the
Yeah.
providers and for the patients. Low burden, not creating extra work for the providers, and something that integrated really well and easily with their clinical workflows. So then we developed Adherely. So it's a free web-based platform, it's HIPAA compliant, secure. It helps providers with engaging the patients in therapy. So we built in a lot of, again, with a lot of provider feedback and user testing. And over time, we built in a lot of assessments, customizable reminders, self-monitoring, journaling tools, and interactive evidence-based digital therapeutic exercises. And with this, providers can Adherely can kind of like support providers through the process of introducing and practicing these with their patients during the therapy sessions. They can then schedule automated text message or email reminders for patients to practice those exercises or complete assessments between the therapy sessions. And these are really simple that because we like simple. The reminders is just a message. It has a link to the exercise or the assessment. The patient clicks it, it opens up in their browser. They do the exercise or the assessment. They close the browser window. They're done. So no downloads or logins on the patient side required. And providers then kind of like review that practice and assessment results over time. And it's really taken off. It's been really cool to see. And we're, with kind of some other stuff going on with it, but that's the gist of it though.
And Nick, but like a lot of therapy homework, there are some common skills like I always come back to. There's like these CBT derived homeworks, and there's like I think a website therapy. I'm not getting the right one, but like there are a lot of common skills we want people to practice that are useful no
Right.
matter if you're doing different generations of CBT or different ones. So it makes sense like a common solution
Right.
for, dare I say, a common challenge is engagement for all of us who are doing it. What has
Absolutely.
it just been like on the side again of developing it? Has like have you guys got feedback where you said we want to make it Hearly more engaging? Like have you is it's a lot of us kind of listening are it's exciting to hear kind of a clinician building it and doing it, but it's also a little bit intimidating. Some of us listening going, ooh, how do you step into that
Oh
work?
yeah. Yeah, that's scary. Very scary, very stressful. But cool. So the process it's very involved, and you have to work with big teams like developers, designers, product managers, and we're constantly getting doing kind of like iterative user testing with providers and with patients, and getting that feedback and trying to integrate that, like synthesize that, integrate that. Um, and I think the way we went about it with that approach of involving, our target end users in the entire process has really been helpful in um, uh, shaping it into something that has, we haven't required like a ton of like modifications to it and like revisions to it because we did those kind of along the way. We still have some work to do with kind of the user interface and user experience that we have plans for that we're implementing soon. But aside from that, though, we've gotten like wonderful feedback, as a result, and our growth, not kind of like organic growth, has been just kind of amazing, as a result, I think.
Yeah. And if I kind of interpret to you're saying you're going to have to, no matter what you put out, you're going to have to keep changing and adapting it because the
Well,
field
yeah.
changes, change. It's not like you put it out and you walk away and
Well,
look at your
right.
beautiful fish tank. Well, fake fish tank
Yeah,
behind
and
you.
exactly right. And if you want people to continue to use uh something, I mean, one, it has to be right, it has to be useful, it has to make people's jobs easier and more efficient and more effective,
Yeah.
right? And if you can do something like that, that's great. That people, though, they have kind of their preferences and their ideas that they'd like to see implemented, and we'd like to see those implemented too. It but it's definitely, a big undertaking, but also like it's like I said, it's been very rewarding
Yeah.
uh to have
But
done that.
there's active engagement on your side as the developer too, is what I'm hearing. And we're talking about a platform to do engagement, but you're saying I have to engage a lot to keep it where I want it
Oh,
to be and keeping up.
absolutely,
Yeah.
absolutely, yeah.
And I think that's an important message too, right? These tools, even ones that solve a very nice use case, like you're saying, they're dynamic. We have to do them too. We can't say we put out app X and then people didn't like we kind of iteratively improve and improve and improve. And that takes it's almost like you would need Adherely for yourself to keep Adherely up going.
Yeah, well, we um we all used it, especially during the development process. And so all of our developers were setting adherently messages and reminders and things like that. Not necessarily for
Okay.
development, but we
That's
were
it.
in
Yeah.
there to say like our relaxation exercise or our mindfulness thing, or like one needed some social skills training. So we have some social skills stuff on there that we sent him. Just joking.
Yeah.
But yeah, and I honestly my I think my wife was getting pretty fed up with me because I kept signing her up for messages. I do think it's definitely important as someone who's creating something to use it yourself. And I will say, like, I don't see patients very often anymore, or for the last like couple of years, because I've been very busy with other things,
Yeah.
fortunately. But I was seeing patients fairly regularly as we were developing this, and I was using it with them, with all of them. So I think it's important as somebody who's developing something to be using it yourself and believe in it in that regard.
No, I think it's a nice again, it's nice that you kind of told some of the theory and research and then kind of talking about this one. I'll transition over to questions. We have a lot, so we'll do as many as we can. One question kind of focuses earlier on the talk and saying, is there any engagement data or study that compares different approaches that therapists may do that shows different outcomes of digital tools? So I can imagine like if you give a coach, does it make this much difference? If you use an app, if you, I don't know, call patients, if you like do we have any kind of nice data that gives like some broad effect sizes of here's approach A, B, C, and D?
I don't know that
Okay.
I'm not saying there
I
isn't.
don't
I
know
don't
either.
though, but I think that's a really cool idea. I think would be quite useful to a lot of folks. But we do know, though, from earlier studies, just um, looking at just text messaging, phone calls, that in and of itself, or on its own, and kind of before we developed a lot of these apps, really is extremely helpful in engagement, practice, and outcomes. And so we know these things work. It's I will say though, from in the literature like I reviewed, there's definitely something about having a clinician or provider on the
Yeah.
other side of that kind of messaging and reminders.
I agree. I don't think I've seen like direct evidence that text messaging gets you this much or like app notifications, but definitely if there's a person behind it, and they can be a coach, digital navigator, clinician, but there needs to be a non-AI person, I think, behind it to really drive engagement in it. But a good question. I think we'd like to see that data. I'll
Very
put
cool.
in the chat. We have a lot of open calls for submissions for papers in JMIR. This is one of them in the link. A different question for you is kind of thinking about what do you think about, again, engagement for non-English speakers around just telehealth and apps in general? Clearly, a lot of these tools are built for English speakers.
Right.
And again, there's many like it's a broad topic, and clearly it's I just want like
This is what I'm
how do you
excited
think?
about.
Yeah.
This is what
Ah,
I'm excited about. And I think it's actually, in my opinion, one of the great things about AI is that you can, with that, we don't necessarily have to redo a whole separate website in Spanish. If you can integrate these tools into your existing app and platform and have it kind of adjust languages. And there are some really like cool and even like free to use like development platforms that actually have like a language translation features, so where that you can implement. This is really from the developer side of things, but that you can implement that, like, yeah, I can do everything in English because that's what I speak, but then people can select what language they want to receive the material in. But I think for
yeah.
personalized messaging, at least, and interactions, AI is like has a lot of potential there.
Yeah. And this question says, has adhere.ly been used with adolescent patients? If so, are there any differences that you do when people are under 18 or any data you can share on younger people? Because
Yeah.
it's different
Yeah.
risks, different benefits of, yeah.
Absolutely. Yeah. So actually we developed it initially for child-focused therapy, child and adolescent focused therapy.
Ah,
And that was our first. So we developed this with funds
right.
from National Institute of Mental Health. And so like the first grant we got to develop this was for that. And um, we did a small feasibility trial with kids and their caregivers, and kids being children and adolescents, right? Um, and it went well. We had, for the adolescents that had their own phones that they were able to get the messages to their phones. For the younger kids that didn't, or parents didn't want that, we would just have them sent to the parent phone. So we actually have a feature in Adherely where um, you select when you're creating a client profile in there, like whether they have a caregiver, what's the caregiver name and the caregiver phone number, and if it's the same as the child's. So then it'll direct the messaging actually towards the caregiver rather than the
Got it.
child. Or if we have parent training exercises in there, so when it sends it uses like the caregiver's name rather than the child's. So it's directed towards them versus the exercises we want the child to do. It'll say like it'll send to the parent's phone, but addressed to the child. But yeah, so in our feasibility trial with the kids though. We found I think we as far as like homework adherence for the kids, we got like a effect size of like 0.47, so that's like a moderate kind of effect, like a decent effect for adhering versus kind of therapy as usual, and we saw a similar result in our adult trial. So it was pretty exciting.
And this question says if adhere.ly is free, how do you upkeep it or keep it going? And I think
Great
there's
question.
different tiers, right?
Yeah. So right now we have the free version, which you have access to all the exercises, etc. And then we have there's a you can get like a pro account that I think is I don't like actually I don't remember how much like 12 $15 a month or like $12 if you could pay for the year or something like that. And that we have kind of some limits on like how far out you can send reminders. So for the free version we keep it to a week, and and then we have for the pro version, like you can send it out up to a year, and then there's custom. You can edit the messages and kind of customize that. We have some other like features that are included, and if it really were up to me, earlier on in my career, I was really focused on let's create free tools for everybody and for public health, and we have done that. But you're right, like these things are very expensive to keep going, and people I don't think realize the costs that are associated with just hosting these tools and all the computing that goes behind it just to go. So not even like continued development costs, but the monthly cost of just having this online and having people be able to use it, is a lot. So that's how the commercialization is how we are able to maintain it and keep that going.
Yeah, no, I think it's probably a good topic for a different webinar, but software is
Yeah, I think
expensive
I
to
think that's a
develop
whole thing on its own
and
for sure.
to keep secure with it. And again, there's always the fear, again, you're not doing it, but sometimes when things are completely free, you go, are the patient's data becoming advertising, which is not what you're like, you're keeping it secure in
Yeah,
it.
no
But
way.
I think it's been hard, right, for the community seeing so many software kind of products come and go in different cases. So I like your approach of giving everyone access to it in some part, but then you're also not charging people tens of thousands of dollars to do
Oh,
this.
no, no way. No
It
way.
to cover the cost of it. So I think for one final question is, again, one of the often ways to get people to engage is clicks, and we talked again, there's kind of push notifications. There's people behind it. Is there anything else that excites you about getting people to engage beyond, again, like there's a person behind it, but we are sending a lot of push notifications to people. Like, is there a world beyond push notifications that you're excited about, or is that just what we're stuck with?
Well, I think one of the reasons why we went with text messaging, which I know is another kind of notification, but it's a different notification, is like one is like uh text message is like the most commonly used app on the phone. It can't be deleted. It's so they're going to continue that engagement in that way, and I think we found that's like pretty beneficial. So I would like I it was one of my partner's ideas to do the text messaging based approach rather than a kind of like a native app with notifications. And I'm so grateful we did do that because it's kind of a unique approach to it. But I think the other way that I've really kind of thought about it in the past, and I know there's a lot of work in this, is really the gamification of this. And there's some people doing some like really cool work in gamified cognitive and kind of behavioral therapeutic, exercises and skill building things that really reinforce not just doing it like doing the skill, doing a good job, but reinforce and reward continued engagement with that practice and improving that over time, and I think that that might be something we integrate with it here later down the road. But I think we know, right? Like
Yeah.
that people are addicted to their apps, right? When they're really rewarding and reward you for coming back. And I think if we could do that with therapy, that would just
Yeah.
be amazing.
No, I think we can do it in the right way. So I think we went a little bit over time, but there are so many good questions. Thank you for really sharing so much from just kind of thinking about telehealth engagement through apps, through AI, and then just the real world experiences, kind of developing one. And the message of the clinicians are end users too. And we can do a lot of good work on that side as well as a nice one. So I'll put again the link to Society of Digital Psychiatry. I've put some of the papers in the chat. We will have this webinar hopefully up there for people to review. And I think some people, Dr. Bunnell, has asked if they can contact you. I imagine they can find your email on your if they
Sure,
say,
yeah.
I imagine,
Lots of other companies and folks do. So,
okay.
but yeah, thank you. Yeah, please feel free to reach out, and thank you all. Thank you for having me, John, and
Yeah,
thanks for everybody who attended. Like it's really awesome talking about these things. So,
this is terrific. Thank you all. Till next time. Bye.
bye all.